Triage, triage, triage. This is probably a word most of you guys have heard before. Triage is a French word that means to sort or to separate out. Triage is also a dynamic process and can change at different time points. So just because a patient was triaged out on the field does not mean that they might necessarily be triaged in the same category after being transported to the hospital. The goal of triage is to use available resources most effectively on patients that are most likely to benefit. In a disaster situation, triage is very different. Triage is based on populations and to do the greatest good for the greatest number of people. And triage goals becomes maximizing the number of lives saved. Mass casualty triage is intended to distinguish those requiring immediate life-saving care from those whom care could be delayed. There are multiple different triage systems available around. There is not one standard triage system in place for a mass casualty incident, and each EMS or hospital system may use their own. There are some more commonly known triage systems that you might have heard about. Simple triage and rapid treatment, also known as START triage, which is one of the more commonly used triage systems. However, this system is not pediatric specific. SALTT is a newer system that may be appropriate triage system for EMS or military and combat situations. SALTT stands for Sort, Assessment, Life-Saving Interventions, Treatment, and Transport. This was designed for victims of all ages. However, this is also not pediatric specific. There currently are several pediatric triage systems that exist. Jumpstart is the most commonly used pediatric mass casualty triage system, especially for children who are under 8 years of age or until obvious signs of pubertal development. Do you know what your local pre-hospital and hospital triage system is?